Good morning, everyone. So nice to see you all today. Very thrilled to be welcoming you to the second annual Enviro-Natal Equity Symposium, or is it the third annual now? We're in the time warp of the pandemic. I honestly forget how many years have passed. But we're very excited to be here in person for the very first time at Oregon State University in Corvallis, Oregon. My name is Emily Little. I use she, her pronouns, and I'm the founder and executive director of Nurturely. Wanted to start by thanking all of our partners that have made this work possible and have really allowed us to expand this work alongside our collaborators. So in particular, Oregon State University's Aspire Center, who are our hosts for today, big supporters of this work, and our collaborators working alongside Perinatal Health Equity and Children's Environmental Health. So I want to start by acknowledging this intersection of why we are here today, this work that we are really excited about. And it's this intersection between climate change, climate action, climate justice, and perinatal health. And perinatal is the word that we use to refer broadly to the period before and after birth. And I want to acknowledge that this is not a new intersection. We're really excited to be hearing new research, new data coming out from our research presenters, as well as new community-based grassroots projects happening on the ground from Nurturely and our collaborators. But this intersection is something that has been around since the beginning of human history. This is widely integrated and acknowledged and practiced in Indigenous communities around the world still to this day. And acknowledging that the reason this intersection needs kind of a rejoining with events like these and work like this is that it has been separated and siloed and really a product of white supremacy culture, colonization, and the practices that have taken this inherent connection between how we nurture and care for the earth and how we nurture and care for our birthing people, our families, our next generation. So we know that these two things are inextricably linked, and because of the silos and the separation of this work, we really need to come back together and rejoin this. So acknowledging the Indigenous wisdom of this intersection and of the importance of this very connected work. I also want to center us in a global conversation. So we are addressing this issue as an anti-racism issue, as a racial equity issue. And although Nurturely's work is local and national, we want to really center this conversation in thinking about the global implications of climate change and perinatal health. And our presenters will touch more on this, but really wanting to ensure that we are thinking about how the 20 richest countries in the world are responsible for 80% of the global emissions. And the lighter colors on this map are representing the countries that are most able, most prepared to deal with the massive threats and loss of property, loss of life, loss of health that is coming with climate change. Whereas the countries in the global south, the darker colors on this map, are least able to prepare and adapt and be resilient in the face of the climate crisis. However, these are the countries that are least responsible for what we're dealing with today. So grounding ourselves in not only the data on perinatal health equity, but really what we can do in terms of a urgent global request for the US as really one of the leading cause of the emissions that we see and the global destruction that we see. So with that, I want to share Nurturely's values. We are coming at this conversation from a foundation of anti-racism and wanting to bring to this work the intersection of research and grassroots activism, but really thinking about we can't talk about perinatal health equity and we can't talk about climate action and climate justice without addressing and working towards and continuously striving for anti-racism in ourselves, our organizations, and all of the ways that we are addressing this work. So Nurturely is a nonprofit organization. We believe that wellness for infants and caregivers is and should be a human right, not a privilege. We know that is currently not the case. There are many layers of systemic and cultural and geographic and financial barriers that dictate who has access to a healthy pregnancy, birth, postpartum, lactation, and who does not have that access. Our goal is to address, acknowledge, and tackle the root causes of the inequities that we see in pregnancy and postpartum health. These are big picture issues: systemic racism in perinatal healthcare, unrepresentative perinatal workforce, pipelines. We know that there are many barriers dictating who gets to be a professional in this space, who gets to work with birthing people and parents, who gets to do the research on these important topics. And then, of course, why we're here today, which is disproportionate impacts of the climate crisis. These are giant, abstract, and complex problems, but our goal is to focus in and tackle bits and pieces of these big picture problems through preventative education, which is primarily for the interdisciplinary healthcare and perinatal health community. We also conduct community-based research informed by the questions that are most pertinent and pressing in the community with regard to perinatal health equity. And then what we'll talk about today are coalition building work, and really our work alongside community partners, community members, to empower advocacy at every level of addressing these issues. So what do we know about the intersection of climate and perinatal health equity? I'm really, really thrilled that we have so much expertise in the room today, and really have world-class speakers who are getting to share their research on this topic today. But I want to just also, again, kind of focus before we dive into the research, before we dive into the projects, really talk about this intersection that we're thinking about at Nurturely, which is we're thinking about this big picture challenge of systemic racism in perinatal healthcare, completely independently of the climate crisis, which is having impacts at each stage of the perinatal journey. At preconception, having different effects than during pregnancy, having different effects than at birth, having different effects than during lactation, where we see bias in the medical space and in the perinatal care arena really impacting and compromising each stage of the perinatal journey. Just as one example, being in lactation, a recent study showed that Black babies were 9 times more likely to be offered formula in the hospital than white babies. This is irrespective of medical condition, irrespective of any risk factors. So we know at this baseline, we're dealing with extreme bias in terms of the care that people receive during this perinatal journey. So we're really concerned with what happens when we add the impacts of climate change on top of this already compromised, really perinatal health crisis that we're having in our country. And as you'll hear from our presenters today, the effects of rising temperatures, the effects of air pollution, the effects of stress from disasters are similarly impacting each stage of this perinatal journey in different ways, and then in ways that compound and interact with one another at every moment of this journey. So our hope with this work and with this event and with these collaborations that we are nurturing and fostering here today and beyond is that we can come up with cross-sector solutions that bring in people from outside of perinatal health. We know that there's lots of people working on this issue in lots of different ways. Our goal is to bring people together and really demand that perinatal health equity be intersecting and at the center of the climate action and climate justice solutions that we know there is momentum and that people are working on. And one of the things we'll be talking about today is climate resilience. And so 50% of US counties are experiencing disasters. This is up from 20% just years ago, and we know that this is exponentially increasing. But one of the reasons I like to talk about climate resilience is that perinatal health equity is climate resilience. It's also climate mitigation. So we can also think about all of the work that birth workers are doing, that grassroots perinatal healthcare workers are doing, as another solution for the climate crisis. So we love to think about, and this is just one example of this analysis showing that increasing lactation as a perinatal health equity goal also aligns with the goals of climate mitigation. So our goal is to really raise awareness of these intersections and ensure that we are all working together towards these shared goals of climate resilience and climate mitigation. The analysis showing that increasing lactation up to recommended levels equates to the emissions reductions of taking almost 80,000 cars off the road. So when we think about that from a policy level and how massive that would be to take 80,000 cars off the road and how fantastic that would be, we can see similar emissions reductions from the work that we're doing in perinatal health equity. So this is both to remind ourselves of the importance of cross-sector solutions and also to empower and build excitement in the perinatal health community, the birth worker community, knowing that the work that is happening already in perinatal health equity is inherently climate work, is inherently climate justice work. And so we'll hear later from presenters on how important this is to acknowledge and support and build and fund and empower in terms of birth workers as climate workers and climate resilience and justice advocates. But we know that right now we are not in a state where perinatal health equity is being recognized as even part of the climate crisis and much less part of the solutions of the climate crisis. So we see that in all of the analyses of all the climate work coming out, all of the climate resources being shared, prenatal health, perinatal health, lactation, these are things that are not being even mentioned, not being even acknowledged. And so we have a lot of work to do to raise awareness of this. So there's lots of barriers to this. One is that people who are not in the perinatal health space maybe don't have any understanding of the perinatal period. Also think that this is a very personal issue when we know it's actually not personal, it's actually systemic. People don't actually have choices in terms of what they want to do for pregnancy. We know the choice for bodily autonomy is being attacked left and right. We know the choice for how you feed your baby is not actually a choice at all, but really a systemic designation based on your level of privilege. So raising awareness that this is not just a personal issue, it's a systemic issue that deserves policy attention as well. And then secondly, the perinatal workforce being under-resourced in addressing environmental harms. So part of Nurturely's goal with our partners at Human Rights Watch and Beyond Toxics and all of our wonderful community collaborators is to resource the birth worker community and the perinatal health community with tools, communications kits, culturally appropriate preventative and proactive information so that they can protect and support their pregnant and postpartum clients in this work. All right, so with that theme of cross-sector solutions, bringing perinatal health equity to the center of this work and building bridges really across to the people doing amazing climate work already, the goal of today is to be interdisciplinary and intersectional. So Nurturely loves to uplift lived experience and community-based work alongside the data and the research that we also know is important. So understanding that there's many ways of having evidence and having information to back our advocacy efforts, we like to really bring light to all of these sources of information to build the strongest case for these policy changes and cultural changes. So today we'll be hearing from the amazing Dr. Rupa Basu, first and foremost, who's joining us from the California Environmental Protection Agency. We are so lucky to have her here. Sandy Ha will be next, coming from University of California, Merced. And then Zainab Jah, who's joining from the Collaborative, formerly known as National Birth Equity Collaborative. And lastly, we'll be having a panel on focusing on wombs and wildfires, which is a Oregon project that Nurturely and Human Rights Watch have been conducting alongside community partners.